was moving around with not much trouble at all. I still took it easy for another week and made sure, and then I went back to work after about 2 weeks. And driving, sitting at a desk job, no real problems after 2 weeks at all. I was able to do these things quite easily. After about 3 or 4 weeks, I noticed that I'd lost a good amount of weight, probably as much as I'd lost trying before, and it was enough to keep me motivated to start this journey. In the first 6 weeks after the surgery, there is a stage where you transition from a liquid diet to mushed food onto your solids. That was a very interesting time, because it's almost like you're eating things for the first time again and seeing how they go. And after 6 weeks and you have your first adjustment, that first meal that you have, and you get this lovely full feeling after just a small amount of food, and you need to teach yourself that I've only had this much, but that's enough now. I don't need it, I feel full. And the fantastic part was it lasted for a long time. I didn't think about food because I was full, and it stayed there. So my whole attitude towards food changed right from the start. I had this fantastic lap band in me that was making me not want to eat. For the first time in my life, I didn't actually ever feel hungry. And after the 6 weeks, also started to walk, something as simple as walking. I'd go for a walk every day. I'd walk for an hour, I'd walk for 5 minutes at the start, and then I'd walk for 10 minutes, then for 20 minutes, and before I know it I was out walking for an hour and enjoying exercise. But my whole attitude towards food had changed. I wasn't thinking about food as much anymore, and when I was I was just eating smaller portions. That's basically what the lap band did for me. There's nothing about me that you can see and say, oh, he's had lap band surgery. It doesn't affect my life in any other way, except it just affects the amount of food that I can eat, which is fantastic. And I've found that it's also changed my attitude towards the types of food that I eat. Because I don't eat large meals now, I tend not to order the big chicken parmigiana and chips. I'd much rather have 6 oysters or a salad or something that's a lot smaller but got a lot more flavour in it. And my palate's changed, and the types of foods that I eat now is vastly different to the types of foods I ate before the lap band. The most fantastic thing about the whole experience for me was it works. So the motivation just stays, because the weight steadily comes off. You see your surgeon, you keep the adjustments up, you have a good relationship with your surgeon, and you'll keep that steady weight loss. And it's easy to stay motivated because it actually happens, whereas before lap band surgery, some things might work for a couple of kilos and then they stop. Some things might not work at all. The lap band, when used correctly, works, and it's been fantastic for me. The lap band's changed so many things in my life that I never thought would change. After losing 56 kilos, my confidence changed. I left a 10-year career to become a personal trainer, from an office job to a personal trainer. I enjoy shopping for clothes. I now am silly enough to run marathons, and the lap band is just a small part of my life now. Like I say, you wouldn't know that I'd had the lap band. I have a good level of adjustment, so I can't eat or drink large amounts, but when I go run a marathon, I go and see my surgeon. We take the fill out so that there's no restriction, so I can run my marathon, I can drink my fluids rather fast. I finish the marathon, and the next day I go back in and have all my fill put in and have the restriction there the next day. So it's as simple as driving your car into a service station and putting petrol in the car. It really is a very easy, livable tool that I have inside me that's a fantastic tool that's helped me lose that weight. Since having lap band surgery and losing my weight, my quality of life has just been fantastic. I enjoy my life so much more now. I've been able to meet a partner and start a relationship. Buy clothes that I actually like, not the ones that are just, in the Mr. Big section that fit me. I can actually go and say, oh, that looks nice, and be confident that I can wear it. There was 2 or 3 reasons like that why I wanted to lose weight, but there's been 1,000 things more that I've enjoyed in the last 3 years since losing my weight, and I've got all that to thank for the lap band. Thank you very much. I've been happy to share my story with you, and does anyone have any questions? What happens when you go out for dinner? You eat a smaller meal, basically. There is a process you go through when you first have an adjusted band, where you need to learn that there are some foods that you probably can't eat as easily as you used to, and there's certain foods that you probably are going to struggle to eat. White bread is something that I've never really been able to eat since having the surgery, but I can eat wholemeal bread, crusty breads, meat. I couldn't eat a tough leathery piece of meat that costs a couple of dollars, but a fine cut of meat that's cooked well and eaten slowly and chewed, I can eat. What was my last meal before my lap band? Good question. It was my last supper. I went out for a nice big piece of steak because I was told that by some people who I know who'd had it done said I can't really eat steak. So for me it was a really big piece of steak, and it was fantastic. But this is fantastic now. I prefer who I am now rather than what a piece of steak tastes like. Have I had any plastic surgery? Myself, no, I haven't. I'm only 29 years old, and I was 25 when I had the surgery. And I've in my opinion, having lost the weight slowly over 18 months, gave myself a good chance of not having any too much excess skin. I do know some people that have it, and depending on the amount of weight you lose, it may be an issue for you down the track. Can you feel the band? I can feel the port. I can't actually feel the band. I lead a very active lifestyle. I ride horses, I ride motorbikes, I run a lot, very active, and I can't actually feel the band. I can feel the port, not so much when I first had it done because it was under a lot of excess skin and fat, but now that I've lost that weight I can just feel a tiny lump there, but you can't see it. There's nothing, no one's going to walk up to me in the street and go, oh, I can see your lap band, or I can see your port. I can just feel it gently. What happens if you get sick or get gastro? The lap band is very easy to live with and adjustable, and it's important to have a good relationship with your surgeon. So if you do have gastro or you get sick and it's a matter of needing the fluid taken out, you just ring up your doctor, your surgeon, and go in and see them. They take the fluid out, you go and get over your illness, and you come in the next day, have the adjustment put back in, and away you go again. It's very easy to deal with. Can you still have takeaway? Yes, you can still have takeaway. There's lots of foods that you can still eat. It's all about choosing the most appropriate food there, the healthiest option if possible, and eating it slowly, taking the time. If it's something that you haven't eaten before, basically you take a very small piece and you put it in your mouth and you chew some more, and then swallow. Wait a second, wait 20-30 seconds, see if it goes okay, and if it does, it's fine, I can keep eating it. What happens with an adjustment? You go in and have regular appointments with your surgeon in the beginning, and you have your first adjustment. And a lot of people think it's going to be quite a scary experience. Far from it for myself. The surgeon will find the port and get the needle out, pretty small needle, and will ask me just to sit up just a little bit. Sticks the needle in till he finds the port. It's not painful. If anything, it might feel a bit weird, but it's definitely not painful. And they'll adjust the band, take the needle out, pop a little band-aid over the top, give you a sip of water, and you will notice the restriction in that glass of water from before you had the adjustment. And that's all. It's as simple as that. It really is an easy process with the adjustments.